Trauma and compounded stress can affect us in many ways. Sometimes we do not even realize that what we are experiencing is an effect of trauma or compounded stress. For example, we may feel sick, but according to our doctors, there appears to be nothing wrong with our body. Studies show that 80% of all physical ailments are psychosomatic, i.e., are physical expressions of a mental upset. These are some of the different ways that both trauma and compounded stress can affect us. Physical responses: headaches, lack of energy, anxiety, panic, jumpiness, excessive alertness, being on the lookout for signs of danger, muscle tension, sleeping difficulties, chronic body pain, stomach aches, poor self-care, disconnection from the body and its sensations. Emotional responses: emotional instability and reactivity, depression, lack of motivation, numbness and detachment, unhealthy attempts at self-soothing, terror, fear, paranoia, shock, anger, irritability, guilt, emotional outbursts, loss of emotional control, anxiety and panic, fantasies of revenge. Mental responses: expectations that bad things will happen, negative thinking, intrusive memories, nightmares, flashbacks, poor memory, visual images of an event, difficulty with thinking and focus, decreased attention, difficulties in problem solving, dissociation from the body, confusion, being overly sensitive, blaming others, inability to recall all or parts of an event, disorientation of time, place, or person, overly critical, difficulty thinking, remembering or concentrating, poor problem solving, poor concentration and memory, confusion, preoccupation with the event or avoiding things that remind you of it. Spiritual responses: anger towards God, loss of faith or turning away from one's religion, extremism, apathy, cynicism, doubt, looking for or turning to magic, crisis of faith, violent martyrdom, that is, killing in the name of God, loss of meaning, questioning God, apathy, denial, emptiness, difficulty in trusting others. Relational responses: difficulty trusting others, problem with boundaries, withdrawal and isolation, aggression, clinginess, dependency, extreme independence. Behavioral responses: aggression, suicide, self-harming behaviors, that is, drug and alcohol use, cutting and headbanging, fainting or collapsing, manipulating others to get our needs met in the best way we know, hyper-alertness, suspicion, withdrawal and antisocial acts, domestic violence, inability to rest, frequent and repetitive conflicts, social withdrawals and isolation, loss of interest in normal activities, inability to relax or sleep, choosing to be isolated. Sense of self responses: shame, low self-worth, self-blame, self-hatred, self-harm, and guilt. Societal effects: gangs, high rates of alcoholism, drug abuse, and mental health issues. For example, depression, lack of empathy and community closeness, corruption, extrajudicial killings, mistrust between communities, tribes and clans, intergenerational transmission of pain, suppression of truth by local authorities. Coping strategies refer to the specific efforts, both behavioral and psychological, that people employ to master, tolerate, reduce, or minimize stressful events. Why is it important to have many different coping skills to manage different situations? We all encounter many different stressors and issues in our lives. We need to have many different ways to manage these stresses. These are called coping strategies. The more varied our coping skills, the more likely it is that we will be able to handle ourselves in a positive and productive manner. Imagine that you're building a house. You have a hammer. The hammer is useful when you need to put nails into the wall. But when you need to screw in screws, you need a screwdriver. And the hammer does not work at all. You can try, but it will not work very well. The more skills you have in your toolbox, the better you'll be able to stay healthy and balanced. We always have options for solving our problems, even if they're difficult. Sometimes we use options that are healthy for us, and sometimes we choose unhealthy options. When we are triggered and our survival brain is activated, we need many ways of coping to help our thinking brain regain control. Now that you're aware of negative impacts of compounded stress and trauma on different levels of our lives, think about the following and share with your group. How do you manage stresses or trauma? Why is it important to have many different coping skills to manage different situations? List examples of different coping skills under the following categories: mental, physical, relational, spiritual, social, emotional, and time for self.